Some of us patients have heard the word veneers and lumineers, even inlays and stuff like that. What are we talking about here? What's the difference between those things? To me, they're all clip-ons, clip-on fingernails.
No, absolutely not. All of those procedures, first of all, you have to remember that are not reversible. Where actually the doctor would take a certain part of your tooth off and put in a thin layer of porcelain to replace missing tooth structure or something that doesn't look good, something that's very stained, or you have a lot of cavities, or if you want smile to be better, would you like some brighter teeth or a little longer teeth? So none of those things are reversible. That's the first thing that the patient must understand. You can't just if you don't like them, take them off. So having said that, that is very important that you go see a qualified doctor, somebody who understands your needs and wants, somebody who will talk to you and work with you, somebody who will understand what you're looking for. And those restorations are all fabulous if they're done right. And Lumineers, for example, is just a brand name of a veneer. They're made a little thinner than the regular veneer and a little more translucent. And the key to everything is to have everything looking natural. Like, for example, as a veneer you do for your front tooth, on back teeth, all fillings can be replaced with inlays and onlays, which are really great because they're as strong as a crown. There's absolutely no metal. They're made completely of porcelain, and you don't have to grind down the whole tooth. You just take out the old filling, and you clean up the tooth, and you take an impression, and you bond in a piece of porcelain that blends in perfectly, and nobody will ever be able to tell that you have a restoration.
Beautiful. So from what I hear here is, you keep mentioning that, you really don't want to grind down a tooth if you don't have that, because you mentioned that at one point where, a person might need an implant versus a 3-unit bridge. If the teeth are good where the bridge is sitting on it, that would be, murdering a tooth, basically, or at least handicapping it, and it's just not good. And you mentioned it now with the veneers and the lumineers. So the lumineer, which is a lot thinner, does not necessarily need, or a lot less, grinding or shaving down the tooth, as you call it.
Absolutely, absolutely. We want to preserve as much of tooth structure as we can, because first of all, it's much healthier for the patient. Second of all, you can always go to a different procedure that you can grind off a little more, but you can definitely not grind off any less.
Right. So once you have overdone it with grinding, then you might have to go down all the way and start putting a whole crown on it or whatever. Anyway, right. So as least grinding as possible. Just like my parents told me not to use my knife on trees and cut things in it, because the tree does get hurt, even though I might not think so. And
absolutely.
Yeah, all right. So you're risking that the tooth might potentially die because he just got operated on majorly if you shave it down. And a lumineer is good there. And good. And rather than that, there's no, for us, the patients, once it's on it, we wouldn't know whether we have a lumineer or a veneer, right? That's what you're saying?
Right. Well, yes, absolutely. It's still, what we do is actually looks very natural. But the most important thing is the communication. We always talk to the patient. We always find out what their expectations are, what they would like, and then we work on the best way to achieve that goal.
Right.
That is very, very important. It's not one thing is better than the other, or Lumineer is better than the regular veneer, or a Da Vinci veneer. There are different companies that make different things. We just want to make sure that the patient is happy with the result that they get.
Correct. Well, again, so that was it for veneers, lumineers, which all falls like under cosmetic dentistry. I mean, that's what people do to have that $1 million smile. If for some reason, their teeth have not been naturally like that, or have been put out of shape for whatever reason. All right. Well, Dr. Zhitnitsky, speak to you with some other topic. Bye-bye.
Thank you.